Alzheimer's Association is out with its annual report, and once again, it shows those who care for loved ones are still struggling. 5 News anchor Darren Bobb tells us what the Arkansas chapter is doing to help.
When someone receives a dementia diagnosis, typical caregiving duties fall to the family and the friends first.
There are 155,000 Arkansans who have Alzheimer's and dementia. That translates into family caregivers spending more than 270 million hours of taking care of their loved ones, all unpaid. David Cook with Arkansas Alzheimer says that kind of care can take its toll on the caregiver.
Those caregivers report higher levels of emotional stress, physical strain, especially as the disease progresses, the need for more intimate interventions and more, physically demanding interventions is needed, of course. And then just the lack of support systems. A lot of people feel isolated.
He says the Arkansas chapter is trying to help out by establishing the Dementia Respite Caregiver Grant Program. It helps caregivers care for themselves.
People are tending, again, to their own personal needs, caring for their family members, taking care of household obligations that they otherwise were not able to do. But the majority of them, again, are trying to just take care of themselves with their break.
He says they only have $200,000 to give out. Compare that to $4 million in Missouri and $1.5 million in Tennessee. Cook says the effort now is to get the state legislature to match that $200,000 as a start.
Because our caregivers need it, our population needs it, and we need to expand our reach of the program. Our analysis has shown that we are hitting those caregivers that make too much money to qualify for Medicaid services, but they don't quite make enough to be able to afford in-home care.
Cook says the goal now is to talk with state lawmakers during the state's fiscal legislative session this spring to try to get more funding for that grant program. Covering news where you live, I'm Darren Bobb, 5 News.
Cook says compounding the caregiver problem, most caregivers have chronic health conditions of their own and suffer from depression.